Hatvet PHARMA welcomes you to the ocean of practical knowledge about small animal practice, that is, Hatvet's YouTube channel. We are thankful to our honorable speaker and session moderators for sharing their valuable time and knowledge with us.
Welcome, my dear friends. So, I am extremely happy to tell something regarding nutrition in dogs and cats. Of course, it's our major concern, and always we wish to have a detailed knowledge of those things in simple technical terms, in the simplest form. That is what I am now giving you. I'm not going deep in, I'm not a nutrition professor. But all these things I gathered from textbooks and out of my practice for the last 30 years. I've been gathering a lot of things, and the essence of those which I've gathered is what I'm giving to you. So, I particularly mention you that very keen to listen to each and every term, each and every word I utter, because each and every word I utter will be having different meanings, and it will be very easy for you to understand. Don't think that things are complex. It will be very easy for you to understand, even in non-technical people. For a learned person can easily understand what I'm telling. See, our people, the veterinarians or the technicians, should know nutrition very well. Almost all of our problems in the clinic are in one way or other related with nutrition. We can understand it very easily. So, having a detailed knowledge or having a deep knowledge in nutrition definitely will aid you and will bring you and push you up to a great clinician, that I'm damn sure. Now, so with your permission, let me start. Feeding of dogs and cats, a practical view. All these are so general things, just to show you. We have dogs, we have cats. So dogs and cats are there, especially dogs are there with us for a very long time, more than 5,000 years. Even when we were, our ancestors who were living in caves, the cave people, they were also having, maybe the wild dogs came to them quite often, and when they came close to those cave people, they might have offered some meat to them, and they might have eaten that meat, and they had a close bonding between them, and so they might not have gone from that cave. So during that time, the people there, they're also like us. They also invited them to keep themselves inside the cave. And so when cave explorers and fossils were found, lot of fossils were found inside the cave along with the people, especially in the Neanderthal age, and even in the Stone Ages. We have lot of evidences of dogs in close association with humans. So those dogs were of this type. Some of the dogs are still alive. We have the foxes, jackals, wolves, minks, coyotes. We have the hyenas. Lot of things are there. And different types of foxes are there. And different types of wolves are there. Even we have new breeds which have arose from the ancient wolf. They're like the Siberian husky. It can be termed even as a wolf, Siberian wolf. Our Spitz just look like a wolf. So, lot of resemblances are there. That was I was telling that. Coming to the same thing is in the felines, the cats, but we never had a close association like dogs because those wild cats were lions, tigers, leopards, cheetahs, etc. And we cannot domesticate them. See, dogs can be domesticated, but wild cats cannot be domesticated. So the association between cats were very less. But as when time went on, small cats rose. They were developed. Those now we have a variety of breeds of cats. And cats also have emotional attachment with us. You know it. Let us go through some basic facts. Actually, the dogs and cats are pure carnivores. And we can say the dogs were pure carnivores early. Now, when we have a close association with the dogs for a pretty long time, slowly we know the Lamarck's theory of evolution. According, we know how the neck of the giraffe is extended upwards, how the neck of the camel was extended. It was according to the theory of Lamarck, they might have browsed onto shrubs on the top. And while million of years were going on, slowly the neck became growing and extending upwards. And so that theory is always applicable and it is always widely accepted. This is a good theory. This is Lamarck's theory of evolution. The same thing happened in dogs also. They were pure carnivores inside the forest, inside the jungle. Slowly, when cultural differences came between modern man and ancient man, we were modernized, we were civilized, we built houses, and we kept our pets along with it. Our pets were dogs, and we, the humans, are generally omnivores, having an inclination towards the vegetarian side. We can eat both chicken as well as vegetarian food. So we can eat both meat and vegetables. So we are omnivores and we have an inclination towards the vegetarian side. So dogs actually were carnivores, but when they came, they had a close association, a long association with us. Slowly, their eating habits also changed. They also slightly became omnivorous. That is what I wanted to explain. But we cannot do this in cats because cats, the system is entirely different. They are obligatory carnivores. They always need meat for their existence. They eat only meat. Their major portion, 98% of the portion of their food should be meat only. Is meat. They can digest only meat. They can digest only meat protein. So they are called as obligatory carnivores. And we know that dogs' food, they need L-carnitine. It is an amino acid. So carnitine is definitely needed for, especially levocarnitine. It is needed for the functions of the heart, and deficiency of carnitine we know very well causes dilated cardiomyopathy. And also cats, they need arachidonic acid and taurine for their normal metabolic activities. And taurine is abundant in the muscles, and so they can eat a lot of muscles. They can eat the flesh, and they will get this taurine. When taurine deficiency occurs, hypertrophic cardiomyopathy occurs in the cat. And arachidonic acid is well present mostly in the animal fat, and taurine is present abundant in the muscle tissues. See, requirement is it is just like the ancient the jungle cat or the jungle dog. The jungle dog, like what all things they require, the same thing is required by the domesticated dog also. So what all things jackal, wolf, fox, etc. eat, the same thing can be fed to our German Shepherd, Doberman, or Rottweiler. That is what I meant. So also in the felines, what all things are being eaten by the lion, tiger, leopard, cheetah, etc. can be eaten by our domesticated household cat. Their activity differs. The wild and the domesticated ones, the activity differs. But anatomical peculiarities are all the same, we know it. And according to the world officials, AFCO, the Association of American Feed Control Officials, they are the official authorities of regulation of canine and feline food, packeted food. They are the official authorities of regulation. The food, generally, what we know about food, the food should contain six nutrients. These are known as nutrients like carbohydrates, proteins, fats, vitamins, minerals, and water. These are the nutrients. Of course, we know we have studied in the previous age classes, in the nutrition classes, what each nutrient is. We are coming into it. Then first let us deal about canine nutrition. As I said, they are also carnivores, but they are not obligatory carnivores. They can eat some grains, some rice, some cooked, some pasta, some porridge, everything they can eat. So they are not obligatory carnivores, but they are carnivores. And they can digest animal protein very well. Which are the animal protein sources? The number one animal protein source is meat. And they are actually carnivores, but not obligatory carnivores. They can survive with meat diet alone. And little vegetable diet also can be added to their food. It will be afforded by them, but they cannot survive in vegetarian diet alone. See, as when human beings are concerned, we always say a human being, he can survive with vegetable food for 100 years, as a vegetarian for 100 years, but they cannot live with meat only for not more than a month. By 1 month, either the kidney will go, the liver will go, the serious problems, there will be atherosclerosis, lot of problems will arise. And also uric acid formation, gout, everything will occur. So that is why we say we are omnivorous. So the domesticated dog's diet even can be compared with the wild dog. Let us first take the protein as the nutrient. Proteins. So carbohydrates, proteins, fats, minerals, vitamins, water, all these are the nutrients. First let us take the proteins. Proteins for the dog. So proteins are can be gathered from the vegetables or animal sources. But unfortunately for the dog, proteins which are gathered from the vegetable sources have a very low digestibility. That means the protein, see actually why the protein is needed? The protein should supply metabolizable nitrogen to the system. That is, protein is a complex nitrogenous compound, and the protein should supply metabolizable nitrogen. The protein has its solid blocks, building blocks known as amino acids. Amino acids are containing amino group NH3. It is called N is nitrogen. So it is a nitrogenous substance. So it should supply enough nitrogen to the system for metabolism. So proteins from the vegetable sources, they have low digestibility, and the protein available in vegetables are of low quality when it is fed to a carnivore. But for us, it is okay. Our digestibility is paired with the vegetable protein. And protein quality, how we determine the protein quality? Protein quality, I was already told about protein. The protein means, it is the only meaning of protein is supply of abundant or enough quantity of nitrogen for metabolic activities. So that is why protein quality is always determined by its biological value. What is the biological value of a protein? Biological value of protein means how much of nitrogen a protein substance can give to the body. Got it? How much of nitrogen per gram of protein or per kilogram of protein, how much of nitrogen it can give to the body. If it can give 100% nitrogen, suppose it is having 100 gram of protein having 100 gram of nitrogen, and it can give all 100 gram to the body for metabolism. The biological value of that protein is 100%. See, we can see this formula. The formula for determining the biological value of protein is mass of nitrogen given to the body from a protein divided by the total mass of nitrogen in that protein into 100. See, it is very easy. To understand that is a biological quality, biological value of the protein, biological quality of the protein, we say. So suppose X protein, suppose a quantity of, suppose 100 grams of protein is there with you. This 100 grams of protein contains 200 grams of nitrogen. Suppose, sorry, 100 grams of nitrogen. So 100 grams of protein contains 100 grams of nitrogen. And it is a high quality protein. It can provide all these 100 grams for the utilization of the body. It is for example. It will never happen. It's an example. So the mass of nitrogen given to the body from a protein is 100 gram. Okay. And the total mass of nitrogen in the protein mass is 100 gram. So 100 divided by 100, that is 1. 1 into 100. 100. So it is 100%. So the biological value is 100%. That means you are having 100 gram of protein which contains totally 100 gram of nitrogen. And the whole nitrogen can be utilized by the body. So 100 divided by 100 into 100 is 100. So it is having 100% biological value. There is no such protein in this world. The maximum biological value of a protein is something around 70, 72, 73. There is no such protein having 100% biological value. So it is only a theoretical thing. 100% biological value is a theoretical thing. But we can assess by certain chemical methods. We can assess. And so I was just telling about the quality of protein. So vegetable protein, the mass of nitrogen it can be utilized by the body maybe something around 20 or 30%. Suppose 100 gram of protein containing 100 gram of nitrogen, but the utilizable nitrogen is only 20 gram. So 20 divided by 100 into 100. You can imagine the biological value. So what is it? Let me calculate. 20 divided by 100 into 100. So the biological value is only 20. It's only 20%. That is why I said vegetable protein is a poor quality protein for the carnivore. For the omnivore or for the herbivore like a cow, that is sufficient. But for the carnivore, it is definitely not sufficient. We are coming into it. What is the protein requirement of the dog? I think you can understand very well. So, roughly we can say according to standards, we can say the protein requirement of the growing dog is 18% of dry matter. And then the adult dog is 8% of dry matter. When it is growing, it requires 18% of dry matter because its body building up is there. So it needs lot of protein. When it has completely built up, as I said in the earlier webinars, when it reaches 1 year of age, development, so the growth, it has become attained puberty. Even though it has attained puberty, the growth will not stop. So in some breeds, we can see that, especially great Danes, large breeds, they will grow up to 1.5 years of age. So as when the development stops, then there is the requirement of protein will become less. That is it. When the adult dog, it is 8% of dry matter. But generally, a dog requires 2 gram of protein per kg per day. See, 2 gram. Generally, never forget this. In the dog, the requirement of protein is 2 gram per kg per day. All the feeding schedule, the feeding volume, everything depends on this thing. How much protein is given because it's a carnivore. In the humans, the protein requirement in a normal human being who doesn't have that much of exercise is 0.8 grams per kg per day. But in the male, it is something around the zero point 0.8 gram per day, and the females, it can be something around zero point 0.7 grams per day. But a man who is working out in the gymnasium and doing regular exercises and hectic works, continuous works, and or an athlete, they needs up to 2.6 gram per kg per day. And if it is a female, they need 2.2 gram per kg per day. See, we need not go after all these things. Sorry, it is not 2.6. So I'm sorry. The normal human being, it is zero point 0.8 and 0.8 in the male and 0.6 in the female. When they work out, it is 1.6 and 1.2. Sorry, it is not 2.6 and 2.2. It is 1.6 and 1.2. Up to 1.6 gram per kg they can take. Let's suppose I am 100 kilograms body weight. My requirement, I am not having a sedentary lifestyle. I used to exercise daily. So I can have up to 1.6 gram per kg per day. That means almost 150 grams of protein I should consume a day. That is my protein requirement. Because I am a person who is doing regular exercises. Or if I was not doing any exercise, my requirement was 0.8 gram per kg per day. That was 80 gram. I need only 80 gram. So I think you got the point. So in general, the dog needs 2 gram per kg per day. And also there is, in athletic dogs, it can even go up to 2.6 gram per kg per day. But going beyond 3 gram per kg per day, it is definitely not advisable, because excess protein will not be metabolized in the body and some protein will be lost through urine, etc. But some protein will be more metabolized, or excess uric acid will be formed. This uric acid can crystallize in the urine, producing and even distributed in the other tissues, forming gout. We know it. And that is why whenever there is gout, the doctor advises us not to take meat food. AFCO recommends, so I said that the American Association of Food Control, that is AFCO, they are the authorities to recommend everything. They recommends 22% dry matter for the growth and 18% of the dry matter for maintenance. That is what is accepted worldwide. That is why in commercial pet foods, the adult pet food contains only 18% protein, and the puppy pet food, they contains 24% protein. Got it? And whatever be the protein, it should never exceed 30% of dry matter, 30% total. Should not exceed 30%. Excess protein, of course, it is excreted. And low protein diet is always recommended in hyperammonemia. Hyperammonemia can happen in hepatic encephalopathy, hepatic failure, kidney failure, etc. Ammonia is released. From where ammonia is released? It is released from every cell in the body after metabolism, after purine metabolism, protein metabolism. And 90% of ammonia is released from the liver cells and the kidney cells. And as I said, so many people are telling that allergy to certain proteins, allergy to that, allergy to these. It is uncommon and not very often, but rarely it can be found. That's why we are going for a hypoallergenic diet in dogs. Especially not in not in cats, but in dogs, it can be found. We know that 85% of the total allergy in our clinics is a free allergy dermatitis. And from where a carnivore gets this protein, as I said, they are meat eaters, they can eat meat very well. Meat is a main source of protein, and meat food is the main source of protein. And meat contains 18% protein. Chicken contains 18% protein. Mutton contains 18% protein. Pork contains 18% protein, plus some amount of fat also. Beef contains 18% protein. Then fish contains 18% protein. Egg contains, one whole egg will contain 6.3% protein, 6.3 grams of protein. One whole egg is coming around 50 to 60 grams, and it contains 6.3 grams, approximately 6.3 grams of protein. So if the yolk is thrown out. It is removed, and only the white is taken. The white contains 4%, 4 gram of protein. Each egg white will contain 4 gram of protein. See, keep in mind all these things. What are, that is why I tell, listen to each and every point. I tell, nothing should be omitted. Meat is rich in protein. Okay, it contains 18% protein. Meat is rich in phosphorus, but it is poor in calcium. That is why when excess meat food is fed to small pups, what will happen to those small pups? They will eat more meat and they'll eat more, consume more phosphorus because it is rich in phosphorus and poor in calcium. But no calcium, it is a developing bone and teeth. No calcium is there from the diet, only rich phosphorus. We have a normal calcium phosphorus ratio in the blood, that is 0.8 is to 1. So this calcium phosphorus ratio has to be maintained. Excess phosphorus will be absorbed, producing hyperphosphatemia. So in order to maintain the calcium phosphorus ratio, parathyroid gland will be stimulated, producing more amount of parathormone, and the parathormone will mobilize calcium from the bones, making the bones so brittle and soft, producing osteomalacia and bowing of the forelimbs. So that is the pathogenesis of osteomalacia. It is known as all meat syndrome or nutritional hyperparathyroidism. You might have heard about all these things. And it is poor in calcium. That is why when meat-rich food is given, offered to dogs, excess of calcium also should be given in order to maintain the normal calcium phosphorus ratio. So, animal products are just like animal byproducts. Byproducts, we know this offals, then dried egg products, meat, meat bone meal, meat byproducts, poultry byproducts. Poultry means not only the chicken, we have the duck, quail, turkey, everything is there. Turkey is excellent for the dog. They have good quality proteins. Then we have the hydrolyzed proteins. And we all know, we the vets, we know very well, hypoallergenic diet. Actually, what is this hypoallergenic diet? It is a grains which is mixed with hydrolyzed protein. Hydrolyzed protein is a typical protein. It is produced from a rich source of protein which is derived from vegetables like soya, corns, wheat, and poultry feathers. And the cheapest source of hydrolyzed protein is poultry feathers. I don't know how they're extracting it. It's a complex process, but they extract hydrolyzed protein from this poultry feathers very cheaply. And this is mixed with the grain and it is marketed as hypoallergenic diet. This hydrolyzed protein reaction against this hydrolyzed protein in the body is extremely low. That is why it is known as hypoallergenic diet. They are highly digestible, they are easily absorbed, they are readily bioavailable, and hydrolyzed proteins are used in hypoallergenic diets. Then coming to the fats and oils. Now we have completed something regarding the protein. Now the fats and fat means it is oil itself. What? Which is the richest source of energy? The richest source of energy, we all may think that is a carbohydrate. No, the richest source of energy is a fat. But the fat burns and releases the energy very slowly. But carbohydrate, it burns and releases the energy quickly, very, very quickly. That is why we say carbohydrates are the quickest source of energy. But fats and oils are the richest source of energy, but slow releasing energy. That is why if we take more fats and oil, they will be slowly releasing this energy, and excess energy or excess calories will be accumulated, and even fats and oils before burning off, before being metabolized, they will be accumulated. So we know all these things. It's a good, richest source of energy. And actually they produce 2.2 times more calories than the carbohydrates. We can imagine it's more than double. We can imagine how much of calorie they will produce. So that is why it is said you have some carbohydrate rich diet, but don't take too much of fat rich diet. In animal fat means the mammal fat and poultry fat are rich in omega 6 fatty acids. Mammal fat means we know mammal fats like we have the pork, beef, mutton, etc. Then chicken, chicken, not chicken, whereas fish fat is high in omega 3 fatty acids. So the mutton, beef, pork, etc., they have a lot of omega 6 fatty acids, whereas fish fat is rich in omega 3 fatty acids. What is the significance of omega 6 and omega 3? Omega 6 is actually needed for the cartilage formation, muscle formation, brain formation, etc. And omega 3 fatty acids are highly essential for the normal maintenance of the cardiovascular system. That is why heart patients are always advised to eat more fish fat or fish. They contain more omega 3 fatty acids. See, omega 3, omega 6, and they are only the essential amino acids, so essential fatty acids, only EFA or some sort of volatile fatty acids. Then coconut oil. Coconut oil contains a lot of medium chain triglycerides. And coconut oil is generally used in veterinary practice against cognitive dysfunction of all dogs. That is why always we advise our pet owners to give at least 1 tablespoon of pure coconut oil daily, especially in dogs aged than 9 years, older than 9 years. Because after 9 years, cognitive dysfunction, what is cognitive dysfunction? They wander hither and thither. This wandering type of aimless walking and all. They forget everything. They piss on the floor because they forgot that their pissing ground was outside the. See, that is the problems with the cognitive behavior. That is a cognitive dysfunction. Cognition is not there. So for avoiding that, we can see from the early bachpanhood itself, even we can start giving coconut oil. That is excellent. You can give coconut oil 1 tablespoon, 7 ml of coconut oil daily to the dog. You can offer through the mouth. But I always advise not to apply coconut oil to the dog's skin. Well, so many doctors do that. It should not be done. And see, I am deviating from the subject. Actually, this is dermatology what I am telling. Just a minute I will take. See, there is a big difference between the human skin and the dog skin. The dog skin contains only very less sebaceous glands and sweat glands than the human skin. We can say 1/20th. If we have 20 glands, the dog has only 1 gland. That's it. So the nature itself says that there is no need of any oil on the skin of the dog. It should always be kept dry. What we are doing, some doctors advise their pet owners to apply coconut oil. So we are moisturizing the skin. That in turn produces untoward effects, especially Seborrhea oleosa. There will be plaques, etc. Flakes. So don't do it. There is no impact in it. There is no good effect in it. There is no use. There is no advantage. Then why should we do it? Okay, leave it. So fish oil, it is high in DHEA and EPA. All these, are essential fatty acids. DHEA means decahexaenoic acid and icosapentaenoic acid. See, these are essential fatty acids which are generally needed for the cardiac, kidney, liver dysfunctions, etc. So the fish oil is excellent, especially for the cardiac issues. We can offer it in hypertrophic cardiomyopathy as well as dilated cardiomyopathy in dogs. Vegetable oils are high in omega 6 fatty acids. And we know fats are solid at room temperature. The basic building molecules of fat is known as triglycerides. That is why when we take our lipid profile, we always take the triglycerides. Some vitamins are soluble in the fat, some vitamins are not soluble in the fat. That is why the vitamins are generally classified into two: fat soluble vitamins and fat insoluble vitamins, water soluble vitamins. The fat soluble vitamins are vitamin D, A, D, E, and K, A, D, E, and K. See, vitamin A especially. Why we are getting the vitamin K injection in that ampule, vitamin A in that ampule, vitamin A. We are getting vitamin A ampules injection. Have you seen it? This is oily in nature. It is dissolved in peanut and given, refined peanut. But it is because it is oil soluble, it is fat soluble, it is water insoluble. So, fats are a rich source of vitamin A, we can say. It contains a lot of vitamin A. Vitamin A will be stored in fat only. Vitamin D, you can say the sunlight vitamins. In dogs, it is not the sunlight vitamin. Then E, tocopherol. Then K, especially we know, manadiol injection. It is also available as oily injections. So, all these things we know. Then other things, vitamin C and B complex. Vitamin C is water soluble, not fat soluble. Vitamin B complex each from B1 to B12, from thiamine to cyanocobalamin. All these are water soluble vitamins. We can provide essential fatty acids. The most important are omega 6 and omega 3 fatty acids. And if there is a deficiency in dietary fat, that is when omega 6, especially omega 6 fatty acids, are deficient, there will be delayed wound healing, dull, dry fur coat, immunity will be there, will be delayed immunity, all these things occur. And high fat always produces obesity. Let us then, now fat is finished. Then the requirement of fat is 1 milligram per kg per day. I didn't write it. The requirement of fat is 1 milligram per kg per day in the dog. Don't forget this. The requirement of protein was 2 gram per kg per day. And the requirement of fat is 1 milligram per kg per day. And carbohydrates. See, 1 milligram per kg means we can easily understand. A whole egg contains 4 milligrams of fat. So how we can understand? The dose of the requirement of fat in the dog is 1 milligram per kg per day. So now the next is carbohydrates. As I said, it's a ready supply of energy. If no carbohydrates, amino acids will be utilized. That we also know. See, especially diabetes mellitus. What happens? Especially type 1 diabetes mellitus, that is insulin dependent diabetes mellitus. There is no insulin, or insulin receptors are blocked, or insulin receptors are inactive, or insulin tolerance occurred. In such cases, insulin is not active and carbohydrates cannot be metabolized. So what the body has to see some source of energy, because the ready activities are there, the speaking, cardiac functions, respiratory functions, walking, muscle functions, tone maintenance, everything is there. Energy is needed. From where the body will find energy? The next ready source of energy is fat. The body will start burning the fat. In diabetes mellitus, the body will start burning fat. So our body fat, if we have diabetes, all our body fat will be lost. We will become thin. Then the next stage, when all the body fat is burnt off, from where the body will find energy? Next is the protein only. We have the muscle protein, lot of protein, muscles are there. Body will be starting burning the muscles. We know it very well. Then we will become both thin, dobala patala. We will become very thin because our muscles will be burned. Too much thin we will become. So that is what happening in diabetes mellitus. And at the same time, the end products are ketone bodies. There will be ketonuria, ketonemia, etc. That is other subject. I'm not going and see. I know all these things, but if I go into those subjects, it will take a long time. And carbohydrates, since they are ready source of energy, they can burn, and immediately in minutes, they can produce heat in the body, especially in cold. See, especially in the colder places, in North India, in the cold times, Mung which contains lot of protein, peanuts, having a lot of protein, a lot of fat, will be eaten only during cold climates. Egg, anda, Egg will be eaten in cold climates. It will be scientific, purely scientific. And they form the base of all nutrients, or carbohydrates. And excess carbohydrate can also always be converted to fat. That is why obesity occurs. Always eating sweet food, doing no exercise at all, and the excess carbohydrate, where should be gone? Should be converted to fat and deposited wherever in the body, around the heart, around the liver, around the kidneys, in the belly, everywhere it gets deposited. And so obesity occurs. So in the dog's diet, it should contain a minimum of 20% carbohydrate. But the pet food, they contains almost 50 or 60% carbohydrate. Some pet food even have 70% of carbohydrates. And vegetable materials are also there which can be converted to carbohydrates. One example is fiber. It's a form of it's a complex carbohydrate. And all the fiber in the food is totally known as crude fiber. There are two types of fibers, soluble and insoluble fibers. Soluble fiber means they can store water inside it. And it can release it can release this water when it is mixed with the stools. So that stools become very loose. That is why we always eat, every day we used to eat soluble fibers. Our diet contains soluble fibers. Which are the soluble fibers? Especially most of the vegetables, kakadi, cucumber, then carrots, then a lot of other fibrous fruits have this soluble fibers. Onion, always having soluble fibers. So soluble fibers can retain or hold a lot of water, and in turn, when it is digested and mixed with the stools, it can release this water into the stools, and stools will be softened and it can easily pass during defecation. The same thing happens in human beings as well as in dogs. The commonest such sources of soluble fiber are fruits and gums. Gums means it is a sticky substance which is obtained from seeds and plants. And soluble fibers has another property. The soluble fibers, they can ferment inside the small intestine, and they themselves can act as prebiotics. Those are the advantages of soluble fiber. And insoluble fibers come from grain of the diet. They are obtained from the grains, especially wheat germ. They increases bulk, but will not give. They cannot retain the fluid, water, and so they cannot soften the feces, the stools, and they cannot be used as a laxative. That is why when grain-rich food is eaten in the night, the next day morning, stools will not go very easily. We all know it. When grain-rich, we eat lot of chawal at late night and eat at late night and then sleep. In the morning, definitely there will be constipation, because this chawal, this rice contains lot of insoluble fibers, especially the endosperm area. So all these things are scientific. Coming through the sources of carbohydrates. Carbohydrates, we generally have three types of carbohydrates. The simple sugars, there is monosaccharides, oligosaccharides, and polysaccharides. The monosaccharides or simple sugars means the glucose, the dextrose, simple sugar, glucose. Oligosaccharides are sucrose, lactose. What is lactose? We know. Lactose is the main sugar of milk. And there is a derivative of lactose in the milk, that is galactose. So lactose is the main sugar. And lactose cannot be digested by dogs, In general, dogs which pups which are more than 6 months of age, or cats which are above 1 year of age, especially cats, adult cats. Then polysaccharides such as starch. Polysaccharides are complex carbohydrates. They can be split up producing simple sugars or monosaccharides. And sugars are found rich in fruits and honey. Different mannose, fructose, glucose, all things are found. In honey, lot of glucose is there. In robusta in plantain, a lot of fructose. Other yellow kela, we have lot of glucose. So all these are things we know very well. And dogs, they can sense sweet taste very well. So you can give this any sweet substance to the dog that I'm coming. Any sweet to the dog, they will tolerate. Then corn, wheat, rice, barley, oats, potatoes, apples, all these are good sources of starch or sugar. So all these can be given to the dog. There is no specific requirement of carbohydrate like we have said. We already said protein requirement is 2 gram per kg. The fat requirement is 1 milligram per kg. There is no such requirement in the carbohydrate. But the diet should contain a minimum of 20%. That is the requirement. Diet should, whatever be the diet, it should contain. If you are, see, generally, commercially made pet foods, they contain a minimum of 20%. As I said, almost 90% of the dog foods will contain 50 to 60% of carbohydrates. All commercial dry foods contain 30 to 60% of carbohydrates. And majority, some pet foods are there which contains almost 65 to 70% carbohydrate. I know very well. This is written. Majority of the carbohydrate are starch in the pet food. From plants also we can extract carbohydrates. That's from fibers. Cellulose is the main fiber. And we know that cellulose is taken from plants. We know from where. So from the roughage, cellulose is extracted. It is very easy to extract. It is derived from the pulp of fibrous plants. And it's a good, see, it contains, cellulose means it is a rich source of insoluble fiber. What is insoluble? That is why in the herbivores we say succulent roughages. The moisture content is very big. Even though the fibers, a lot of fibers are there. Their fiber content is rich in water. They can hold a lot of water. That's why they are known as, they are insoluble. They are insoluble fibers. So, this cellulose is added to cat foods. We know there are certain preparations which contain certain ingredients. As the company says, they have certain properties of removing hair balls. You know, the cats always lick their hair cut, the fur cut, and always they will be swallowing their own fur, and the fur will form a ball inside their small intestine and also the stomach, and most often they will be vomiting it out. So, against fur ball formation, there are certain diets available, commercial diets are available. All these commercial diet available against this fur ball formation contains cellulose. And we have the grains. They are also rich source of carbohydrates. Barleys, corns, oats, rice, wheat, rye, etc. You know the all grain. Take one grain. Let us take wheat. Wheat contains bran, and the germ and the endosperm. Bran means the outer hull. It is rich in fiber, we know very well. Otherwise, when it is ground, it becomes polished. That is why we say rice, red rice, unpolished rice. It is rich in fibers. This fiber is rich in omega 3 fatty acids. And that is why polished rice is actually not good for health. So, the whole grain contains an outer bran, then just a medial portion, immediately into it, it contains a germ, and the central portion is the endosperm. The endosperm is actually kept there by the nature as a food for the newly germinating plant. So it contains a lot of starch. The endosperm contains the whole starch. So the refined grain meals, they contain only the refined grain meals, they contain only the endosperm. See, when this bran and germ and endosperm is, they are removed part by part, or they are splitted. They are split. The endosperm remains, which is the richest source of carbohydrate. This this is how maida is made. Maida is nothing but the endosperm of wheat. It contains lot of carbohydrate with gluten. That is why we say that this maida products made by maida will be having very high calories, especially all the bakery items, rich in calories because most of them are made of maida. So that is the endosperm of the wheat. And the endosperm contains not only starch but also gluten. For in diabetes diets, endosperm is always removed and only the germ and the bran is used for eating. In obesity also, more fiber and more bran, but the endosperm should be removed. Endosperm, you see, all the split items are available in the market. That is known as a grain byproducts. Grain is split. The bran means it is outer layer of the grain, contains more fibers and omega 3 fatty acids, vitamins, and minerals. So, if we remove the bran and throw it away, we are actually throwing the most nutritious part, the powdered bran. It even extracted, squeezed, and bran oil is taken. It is rich in essential fatty acids. So, certain lot of vitamins and minerals, especially vitamin B1, B1 and B2, yes, and B2. Then the next form is the germ. So next is the gluten, the endosperm. The endosperm contains, I have already said that endosperm contains a lot of starch. Plus it contains another protein source known as gluten. This gluten is always said that sometimes in very, very few animals, gluten produces a sort of skin allergy. It is extremely rare. And this gluten is the lowest cost protein in pet food. 1 gram of corn gluten meal contains more than 50% of protein than found in 1 gram of chicken. You see how much of protein, vegetable protein is found in the endosperm. 1 gram of corn gluten meal. The gluten and carbohydrate are the ingredients of endosperm. If carbohydrate is dissolved and removed, the remaining portion is gluten. 1 gram of corn gluten meal which contains more than 50% of protein than found in 1 gram of chicken. 1 gram. See, what is the protein percent of protein in the protein percent in chicken? It is only 18%. Here 1 gram contains more than 50%. There is only 18%. That is what I am telling. So actually we can go for gluten, but Refined gluten, everything is very expensive, very expensive. That is why we are not incorporating this in the dog's diet. The hull is outer covering. It can be used as a fiber roughage. It absorbs water. Can be used as a laxative. And the floor, that is the endosperm floor, that is nothing but the starch. It is high in starch. Corn gluten can be considered as the lowest cost protein source. Otherwise, we had another protein earlier from feathers, bird feathers. That is a hydrolyzed protein used to manufacture hypoallergenic diets. Then legumes such as peas, lentils, soybeans, beans are rich sources of proteins. We are coming to root vegetables, the beet pulp, the sugar beet pulp. After sugar beet processing, we have the sugar beet pulp. The pulp itself is a good fiber diet. Then another rich carbohydrate source is cassava, that is tapioca. It's a root, it's a tuber, rich in carbohydrates, highly digestible. It can be cooked, dried and powdered, rich source of carbohydrate. It's grain free. Of course, another thing is coming, the next is tapioca. So potato. Potato is rich in source and potato can be considered superior to tapioca. The potato starch is more digestible and advantageous. That is why we always recommend our pet clients or pet parents to give cooked and smashed potato daily to their pet. Why? Because they are not easily digested and they are resistant to be digested inside the small intestine. Instead of digestion, they will be slightly fermenting inside the small intestine, perpetuating and stimulating certain bacteria, and they will be producing certain vitamins. In fact, they are acting as prebiotics. Prebiotics are those substances which nurture the flora, the bacteria, or the gut flora. Probiotics, actually, we are supplying the flora. Prebiotics are those materials which enhance or nutrify the flora, nourish the flora for their more activities. So potato starch, cooked and smashed potato is excellent for the dogs. These are not for the cat, this is only for the dog. Cat system is entirely different. As I told it, they are obligatory carnivores. Don't give potato to the cat. Don't give tapioca to the cat. Don't give wheat to the cat. Don't give rice to the cat or corn to the cat. That I am coming. Then coming to the vitamins. So next ingredient or next nutrient is a vitamin. 5 characteristics of the vitamin. It's an organic compound but not a fat, protein or carbohydrates. It's a vitamin. What is vitamin? It is vital amine. All vital amines contain NH3 group. NH3, nitrogen and 3 hydrogen atoms. NH3 group, amino group. So they are vital amines. That is a white amine. The term came like that, white amine, vital amines. They are essential for the body, vital for the body. Amines which are essential for the body. It's required component of diet, essential only in small amounts. Deficiency causes malfunctioning. We know. Lot of vitamins are there. The fat soluble and water soluble vitamins are there. I mentioned already. Some of these vitamins cannot be synthesized in the body in sufficient quantities. We know all these things. Fat soluble vitamins are A, D, E, and K. Vitamin A, it is found as retinol in the body, especially in the eye. For the vision, the rods and cones need the retinol. It is a derivative of vitamin A. Vitamin A will be converted to retinol and will be used by the rods and cones for the normal vision. So if there is vitamin A deficiency, there will be impaired vision. There will be impaired growth, impaired reproduction, especially for the ovarian growth, functioning and everything. For the hormones to act, we need the vitamin A. For the skin, For the rejuvenation of the skin, we need vitamin A. Immunity we need. AFCO recommends 5,000 units per kg dry matter of vitamin K per day. That's a requirement. Fish oil, liver, eggs, dairy products, etc. are the richest sources. Liver contains a lot of vitamin A. That is why when cats eat a lot of liver, they develop a disease known as a kangaroo sitting posture. That I will come to it. I'll come to it. Then vitamin D next is vitamin D. Ergocalciferol. In humans it is known as the sunlight vitamin. But sunlight is not needed for the conversion of ergocalciferol to cholecalciferol. That is why we say in dogs, in animals, it is not a sunlight vitamin. But the ergocalciferol can be seen coming out through the sebum as cholesterol and they contain some vitamin E. Vitamin D, D2, especially they will lick off. They will be licked off, then converted in the intestine to vitamin D3, D4, sorry, D3. So the cholecalciferol, all those things. I'm not going deep into it. It is purely dietary. No sunlight is needed and needed for the normal calcium phosphorus ratio. AFCO recommends 500 units per kg DM. And the richest sources are marine fishes, fish oils, yogurt. Yogurt is excellent for the dog. Eggs, beef, liver, dairy products, freshwater fishes. All these contains a lot of vitamin D. Vitamin E, especially essential for the skin. We know it. Tocopherol is an antioxidant. It's an excellent antioxidant. And it has least toxic vitamin. Whatever the dose you give of vitamin E is available as 200 milligram and 400 milligram capsules. Whatever the dose, you give 1 gram of vitamin E a day, nothing will happen. But AFCO recommends 50 units per kg dry matter. Only plants synthesize vitamin E. So there is no much vitamin E on the animal muscle. So vegetable oils, seeds and cereal grains are the richest source of vitamin E. Vitamin K, we know the clotting vitamin. It is essential for blood clotting. Manadion, we know the K2 and K3. K1 and K3, sorry, K1 and K3. K3. AFCO recommends 1.64 milligram per kg daily for dog. And it's only dietary. There is not synthesized oil seed meals, liver, fish meals, etc. Then coming to water soluble vitamins of B and C. The B complex and the C. Coming to the B complex, B1 is thiamine. We know the richest sources, whole grains, yeast, liver, etc. And we know the role of vitamin B1 in the brain. That is why every doctor, whenever there is a brain disease in a dog or a cow or a goat, always inject vitamin B1 or vitamin B complex. Actually, meaning the vitamin B1 only. They will stimulate the nervous system. Essential for the nervous system. For the enzymes, we know in the bovines as well as in the dogs, acetyl coenzyme A is needed for the conversion of arachidonic acid. So, this thiamine, TPP, enzyme TPP is needed. Thiamine pyrophosphate, it is in the brain. And AFCO recommends 1 milligram per kg dry matter. Then B2 riboflavin. Riboflavin deficiency is not so common in dogs, but it can produce periorbital dermatitis, periorbital alopecia. It's so typical in the dog. It's very rare. AFCO recommends 2.2 milligram per kg dry matter. And B3 niacin. As a niacin in human beings, it causes blue tongue or black tongue or tongue cyanosis. But you should not say that in a chow chow there is B3 niacin deficiency, because normally the tongue of chow chow is blue in color. You know, we all know the breed chow chow. AFCO recommends 11.4 milligram per kg dry matter. Then B5 is pantothenic acid, involved in carbohydrate metabolism, fat and protein metabolism. AFCO recommends 10 milligram per kg dry matter. It is abundantly, it is rich in liver, heart, rice, wheat bran, peanut, yeast, fish, especially in chicken heart. That B7 biotic. We all know, we have studied in our veterinary classes that biotin has an anti-metabolite, avidin. Avidin is seen in raw egg, and while it is cooked, the avidin will be lost. So never eat raw egg. The avidin in the raw egg will antagonize the actions or nullify the action of vitamin B7, that is biotin. Biotin deficiency occurs. See that there is no such thing in the dog. You can give any number of, according to the dose, any number of raw egg to the dog. No biotin deficiency occurs practically. I've been exercising this for a very long time. I've never seen a B7 deficiency. In the humans also, it is not. It is possible according to theoretical studies. But lot of people I used to see regularly drink raw egg. But there is a problem, we all know, salmonella. Salmonella pullarum. Rickettsial, some sort of rickettsial organisms. They can be transmitted, ovarian transmission can occur through egg. So that is not hygienic. Then B12, it is cyanocobalamin. AFCO recommends 0.022 milligram per kg dry matter. Deficiency causes, we know, pernicious anemia in humans as well as dogs. Plants do not synthesize, and so vegetarian dogs get anemia, definitely. Minerals. Microelements are there. Macroelements, calcium for the teeth and bones, clottings, blood clotting, calcium is needed, deficiency, definitely. 99% of the calcium is stored in teeth and bones. Hypocalcemia and kidney failure, definitely this. Hypocalcemia and kidney failure because of loss of calcium, calciuria, loss of calcium to the urine. Then, you know the purpural eclampsia in bitches, newly whelped bitches. Calcium, when the calcium level goes and reaches at a level of 7 milligram per deciliter, eclampsia starts. Generally by 1.5 to 2 weeks of time after birth, after whelping. Phosphorus, I have mentioned about, I have described about hyperphosphatemia, that is nutritional hyperparathyroidism or Almeida syndrome. It is a secondary structural component of the bones and the teeth. AFCO recommends 0.8% in diet for the growth and 0.5% in the maintenance. So meat is rich in phosphorus. So Almeida syndrome or nutritional hyperparathyroidism, I have already explained what is a nutritional hyperparathyroidism. Magnesium is a structural component of the bone as well as the teeth. AFCO recommends 0.04% for growth and 0.08% for the maintenance. That is magnesium. Potassium. Of course, potassium is the chief intracellular cation. Nobody can live without potassium. Nobody can live without sodium. That's it. Sodium is always kept outside the cell and potassium is always kept inside the cell. And when this harmony is changed, our total harmony is lost. The membrane permeability will be lost. So that is hyperkalemia, hypokalemia, everything. I am not going into details of all these things. This I will take in another class of fluid therapy. So iron deficiency. Iron. AFCO recommends 80 milligram per kg per day in meat, liver, spleen, eggs, especially in liver. Lot of reserve iron is there. There is one liver in this world, in domesticated animal, where there is no reserve iron. Which is that? It is nothing but the pig. That is why we have piglet anemia. They have no reserve iron. That is why we always give Imferon injection to the piglets. They have no reserve iron. And we say, this is the only condition in veterinary science where we should give iron injection. So iron is a very important, but we know the hemoglobin. Iron is the main content of hemoglobin. So we know the iron metabolism. We know the production of bilirubin. Everything we know. I'm not going into details. Then copper. AFCO recommends 7.3 milligram per kg dry matter. Organ meats of cattle, excess cost of iron. See, copper is also needed for, along with iron, copper is also needed along with the folic acid needed for erythrocyte maturation, hemoglobin formation, etc. So, Excess of iron, hypercuprinea, produces copper toxicity, can produce a disease in humans known as Wilson's disease. There will be hemoglobinuria. Breed susceptible to high hepatic copper toxicity. This is very important. Bedlington Terrier, Skye Terrier, but fortunately, we don't have Bedlington and Skye Terriers in our place. Then AFCO recommends zinc. Zinc is very important, especially for the skin. We have skin responsive dermatosis. So, our Hatvet Pharma is having zinc containing vitamin tablet. I think they contain 20 milligram of zinc per tablet. That's excellent. The AFCO recommends 120 milligram per kg dry matter per day. And manganese, AFCO recommends 5 milligram per kg dry matter. Selenium, it's again like vitamin E, it is an antioxidant. AFCO recommends 0.11 milligram per kg dry matter. Iodine, yes, I know the role of iodine is too high. Excellent, it is always dangerously or critically needed for the thyroid functions. And thyroxine hormone is essential for all the activities. We know if there is iodine deficiency, but it is goiter or hypothyroidism. Then coming to the last nutrient is water. The requirement is 2.5 times the amount of dry matter they eat. 2.5 times the amount of dry matter they eat. Suppose they are having 100 grams of food, they should drink 220 ml of water. The requirement of water is 50 ml per kg per day. Suppose a dog is 10 kilograms, it should drink or it should get water at a dose rate of 50 ml per kg per day. That is 50 into 10, 500 ml. 500 ml per day. It should drink at least half a liter of water a day. But it is not like for us, for the human beings, they should, each and every human being, especially during summer seasons, we should drink 1 liter per 30 kg body weight. So I said I am 100 kilograms. I should drink a minimum of 3.5 liters of water a day. Every day I used to drink at least 4 liters of water. I should drink at least 3, 4. See, so whoever happened to listen to my talk, they should remember all these things. Otherwise, we will get urinary tract infection. We'll get all the stones. Everything will be precipitated in the kidney as well as the bladder. The same thing happens in the dogs and the cats also. If they are not allowed to drink that much of water, if they are not consuming that much of water or moisture, they also will get these urinary infections or stone precipitations. So, especially we know about the feline lower urinary tract disorder. In the felines, it is a hell of problems we are creating, especially the food companies, especially these new cats, Persian cats. They are fed, they eat only this raw food, this dry food. Dry food contains a very little portion, 5 to 10% of water only. They are eating only this, they are digging nothing at all. Always these type of cats, these Persian cats, get this FLUTD, urinary infection, frequent urinary infections, cystitis, bladder stones, everything, urine blockade, everything. It's only because of human created things. Since that nothing is happening in the stray cat, because they are eating all raw meat, raw fish. They will come to the mama's kitchen. The mama, while cutting the fish, they will eat all the offals. They will catch everything, they will eat everything happily. It contains the raw fish. It contains 70 80% water. They are getting good source. It's a good source of water. They are getting it happily. They are very happy. There is no urinary infection, nothing at all. They are eating only raw flesh, especially in the wild ones. The tigers, lions, leopards, cheetah, etc. They eat only the wild, this raw meat. So rich in water, it contains 80%. Raw meat contains almost 80% water. Then coming to the feline nutrition. They are entirely different, as I said. They are obligatory carnivores. They need meat for their survival. They cannot utilize plant proteins due to the lack of enzymatic pathways. They cannot. Don't try to feed any vegetable things to the cat. If at all somebody tells that my cat is eating vegetables, no, no, no. Cat cannot digest vegetables. They are obligatory carnivores. But sometimes the cat will come out, they will eat some grass. That's only for their normal digestion. Little bit of grass. And because another thing is taurine is abundant in the muscles. That's why they are eating flesh and carbohydrates. Like in the say, at least a minimum of 20% carbohydrates should be there in the dog's diet. But in the cat's diet, nothing is needed. Only 1 to 2% carbohydrate is needed in domesticated cat. Otherwise, no carbohydrate is there in the for the lion or the leopard. From where the carbohydrate is getting for the normal activities? So yeah, they are eating the flesh. It contains a lot of glycogen. Or the glycogen, what is glycogen? The stored carbohydrate only. They eat this glycogen also. Glycogen will be metabolized to produce some carbohydrates that is needed for their normal activities. That's all. Otherwise, also the richest source of energy in them, the cats, is nothing but the protein only. It's not the carbohydrate. When you give meat, they will be happy because they are obligatory carnivores. No sugar or carbohydrate is needed for the cat's diet. That is why the God has given no sweet receptors, sweet taste buds for the cat. The cat cannot sense any sweet. The reason is this thing. They do not need it. They don't need it. Then why unnecessarily the hell we are giving this carbohydrate, the sugar? No, it's not needed. Somebody say that, okay, you man, you go there, you take the medicine, you powder it well, you put some honey, it will be very tasty and sweety, then paste it over the mouth. The cat will spit it away, the honey, because this sweetness of the honey cannot be sensed by the cat because there are no taste buds. Then why we are doing it? Unnecessary. And now my viewers, my listeners, please understand that cat has no taste buds which sense sweetness. And they have no very strong thirst because they also need 50 ml per kg water a day. But what is their body weight? 2, 3, 4. And weigh. The domesticated cat is 3 kgs. They need only 150 ml of water. So give succulent food, moist food, give raw meat. 100 grams of raw meat itself contains 80 grams of water, 80 ml of water. Again, 100 grams give 160 ml of water. That is sufficient for a 3 kg cat. See how the 3 kg cat is maintained. So wet food is the best, or the canned food is the best. If no wet food or moisture in the food, then they will definitely develop urinary tract infections or FLUTD. FLUTD we know, feline lower urinary tract disease. UTI is seen more in dry food eating cats. I've witnessed several times. I advise my pet owners, my pet parents, not to do this. Meat contains 70 to 75% water. Dry foods contain only 5 to 10% water. Canned foods, they are the richest source of water. Commercial foods, they contain almost 75 to 78% of water. So canned food is high in water content, low in carbohydrate. See, carbohydrate is not needed. Animal proteins only, not only, no, animal proteins only, no plant-based food. Liver can be given only in small amounts since high vitamin A. That is what I want to describe again. Liver contains not a vitamin A. If we give more amount of vitamin liver to the cat, there will be hypervitaminosis A. Due to chronic hypervitaminosis A, there will be fusion of the intervertebral disc and calcification of the intervertebral disc and fusion of both the vertebral bodies. And the vertebral body will act, it cannot flex the vertebral body. But it acts like a stick. Cannot flex because it is completely fused. That is ankylosing spondylitis. Ankylosing spondylitis occurs. And the cat cannot flex while sitting, the cat cannot flex the body and sit. So it sits like a kangaroo like this. It cannot flex its body. Another thing is that it by bending the neck, it cannot lick the body or groom the body. It will be having a very nasty, very unfilthy haircut, filthy haircut, unthrift haircut, due to lack of grooming. The kangaroo sitting posture is pathognomonic to hypervitaminosis A in the felines, especially those who are having lot of liver daily. And also, when cats they consume lot of dog food. Unlike cat food, the dog food has lot of liver. In the cat food, no liver will be added, very little liver. But in the dog food, lot of liver will be added. A lot of vitamin A will be there. They will. And if the cat goes and eat the dog food daily, slowly by 2 3 years it will develop ankylosing spondylitis. So whenever my friends you see this kangaroo sitting posture in the cat, please come to know that it could be hypervitaminosis A. These are the common dietary health issues like diabetes mellitus, obesity. All this can happen in the cats. CKD due to lack of water, due to chronic dehydration. Cystitis, urethral block, bladder stones, kidney stones, IBD, hairballs, hepatic lipidosis. If the cat is undergoing anorexia for more than 2 days, fatal hepatic lipidosis can arise. That I will explain in another webinar. It is a matter in fluid therapy webinar. I'll come to it. Dental diseases, dental tartar plaques, etc. Feline asthma, allergic airway diseases. All these things can happen as a common dietary disease, dietary health issues. Average cat should eat 180 to 220 calories per day or 5 or 6 ounces of canned food. The general dose of a dog food is 50 gram per kg per day. This is the general dose of pet food. But the cat food is 180 to 220 calories per day or 5 or 6 ounces of canned food a day. Canned food a day. Cats should not be starved for more than 24 hours. Fatal hepatic lipidosis occurs. The cat may die. Another thing is that very soon hypokalemia occurs in the cat. And you know about hypokalemic myopathy and all. It will down their head, flex their head, and the tip of the nose may touch the table. Only in cats, protein is the primary source of daily calories. In dog, primary calories is being taken from burning the carbohydrate, but it is the cat, it is not burning the carbohydrate, it is just burning the protein only. And kittens, they lose their ability to digest lactose by 12 months. That is why it is said in dogs above 6 months or kitten, especially in kittens, cats above 1 year, need not be fed with milk. If lactose will not be digested, sometimes diarrhea occurs. See, what is the use of milk? Milk is needed only for the infants. The God has given this milk only for the young ones. The cow is producing milk only for their calf. Buffalo is producing milk only for their buffalo calf. The bitch is producing milk only for their pup. Queen is producing milk only for the kittens. From the cow, we are draining out all the milk for our consumption. Why we should consume milk? The humans, they should consume milk only up to 6 months. That is scientific. For the dogs and cats, they should consume milk only up to 45 days, 1.5 months. That is scientific. Beyond 45 days, it is not needed because they have started grabbing other foods. Then why should they need? After all, milk contains 4.5% protein, 4% lactose, 4.5% fat. See, only the small things are there. It's only for the baby. We say contains everything. It contains protein, fat, carbohydrate, minerals, vitamins, everything it has. Okay, it's only for the baby which is not able to eat any other food from outside. Okay, am I true or not? I'm true. It's reality. Then we know the nutritional secondary hyperparathyroidism in dogs. I already explained it. When pups are eaten, I'll narrate a story. I went to a house of a breeder. I saw a big generation of small pups and having bowed forelimbs. and his brother was having he was a butcher, was having a lot of meat, especially beef, buffalo meat. He was giving all his buffalo meat for his pups, and they all developed rachitic groceries and rickets due to secondary hyperparathyroidism. It was very easy for me to diagnose it was all meat syndrome. Abundant meat in developing stages, high phosphorus but low calcium, hyperparathyroidism, mobilization of calcium from the bones become osteomalacia, easy fracture, wobbling gait, stunted growth, all these things can happen. What is the feeding schedule in dogs? Up to 3 months, 5 times a day. Up to 4, 5, 6 months, 4 times a day. 7, 8, 9 months, 3 times a day. 10, 11, 12 months, 2 times a day. By 12 months, actually it becomes an adult. Above 12 months, once daily. But this is not applicable to all pregnant and nursing females. They need 25 to 50% extra food in more frequencies because they are lactating, they are carrying, we know it, the pregnancy ration and the nursing or lactation ration. Is a feeding schedule of cats. Kittens should be eaten, they should eat 4 to 5 times a day. Adults 2 or 3 times a day. It is not like dogs. 2 or 3 times a day, depending upon the client. In some situation, hypokalemia even can develop if they are underfed. And this is the same thing in dogs, not applicable to pregnant and nursing females. They need 25 to 50% more food in more frequencies, especially when they are lactating. Somebody may ask you how to feed eggs. The protein required, everything is required, this egg to the dog. Everything is dependent upon the protein requirement. The protein requirement in the dog is 2 grams per kg per day. Animal protein sources are egg and meat. The bioavailability of animal protein is very high. One whole egg contains 6.3 grams of protein. And egg white itself, only egg white contains 4 grams of protein. So if only egg is taken as a source of protein, in the dog's diet, in a 35 kg weighing Labrador, what should be the egg requirement? How many eggs can be fed if egg is the only diet? So we need protein only. One egg contains 6.3 grams of protein. So 35 into 2, that is 70 gram is the protein requirement in the 35 gram weighing Labrador. So in the 35 kg weighing Labrador, 70 gram of protein is required. And how many eggs? One egg contains 6.3 gram protein. So for the requirement of 70 grams of protein, how many eggs are required? 70 divided by 6.3, 11.11. So in that animal, a Labrador which is having 35 kilograms body weight, we can maintain with 11 eggs a day to meet the normal protein requirement. That is true. And one whole egg will contain 4 grams of fat. And the requirement of fat in the dog's body is 1 milligram per kg. So one whole egg will contain 4 milligrams of fat. So the total fat requirement in that 35 milligrams of fat. So actually 11 eggs it contains 44 milligrams. It's all admissible, can be given. So 11 eggs to that animal, okay, sufficient per day. If anybody can give 11 eggs a day with some bulk, some sort of calories, because for the regular daily requirement, energy requirement, calories should be given, like carbohydrate, some sort of rice also can be given. But the protein requirement is met with. If it's a working dog, okay, 1.6 gram per kg per day, we can calculate it accordingly. But when we are giving, everything should be calculated according to the protein requirement. But in this 35 kilogram weighing dog, if you are going to give 11 eggs a day, no more protein, no more meat should be given because you already attained the maximum level of protein for that. No more proteins a day. And in dogs, you can feed raw eggs. Nothing will happen. It is from my experience and from my studies, nothing will happen. No avidin, no biotic deficiency, nothing will happen. These are some questions commonly raised by the public. Can raw eggs be given to dogs? Yes. Can salt be given to dogs? Yes, yes, yes. Salt can be given. I always advise my dog owners, taste a piece of dog food, dog food. It is salty. Do you think that fools are sitting there in that nutritional company? They are all PhD graduates, nutritionists. They all compute the food. The salt can be added to the food. Some people say salt when added to the food, this hair fall may occur. No, nothing at all. Or required amount only. Don't give too much. See, if we take too much of salt, our BP will rise. Kidney disease occurs, brain disease occurs, liver disease occurs. And in certain conditions, especially in heart diseases, this salt restriction should be there. All those things are natural. That should be done. Can sweets or sugar be given to dogs and cats? Yes, yes, yes to dogs. Nothing will happen to dog provided they have minimum exercise. But lazy breeds like Labrador, lazy breeds like a Dachshund, if you're giving too much of salt, sugar, may produce obesity. Make them walk. Otherwise, it may produce obesity. Can fat be given to dogs? Yes. The requirement of fat is 1 milligram per kg. Give it according to that dose requirement. Can pork be given? Yes. Don't give the too much of pork fat. The pork muscle, give the pork muscle. But that too well cooked. If other meats are used, can give half cooked. And pork is given, should be well cooked. Can bone be given? Yes. Can liver be given to dogs and cats? So another the cat sweets or sugar be given to dogs and cats? Yes, to the dog, but not to the cats. No use. Can liver be given to the dogs and cats? Yes, yes, yes to the dog. Nothing will happen. But in the cats, only little quantity of liver should be given. I already mentioned what will happen. Hypervitaminosis A. Can offals be given? Yes, to the dog as well as the cat. Can wheat be given? Yes, to the dog. Because wheat contains gluten, which is a source of protein. It's good source of protein. It's good. Can raw fish or raw meat can be given to dogs and cats? Yes, yes, yes. It can be given. But if a dog is right, a dog suppose it is 2 years old. For the last 2 years, it has been offered. We offer only cooked meat, and on a fine morning you are giving raw meat. It will be vomited out. Everything will be rejected, and gastroenteritis occurs. Don't uh, change that routine. If you want to give raw meat, give the raw meat from bachpanhood itself, from childhood itself. When it is a pup itself. It won't eat the raw meat. If it is regularly fed by cooked meat. If it only eats it, vomit out. On what age meat and then can be given to pups and kittens? Yes, I said that it needs mother's milk only up to 45 days, 1.5 months. From the 1.5 months, you can give any food. Because in the wild, it is being done. Even by 20-25 days of age itself, the mother will start offering meat to the young ones. Cubs, tiger cubs, lion cubs, etc. We used to feed them only. Is milk mandatory in pups and kittens? Only up to 45 days. It is not needed. It is not necessary in pups and kittens more than 1.5 months. Can milk give given to adult cats and dogs? In adult cats, it is not digested at all. Adult dog, it is not necessary. If you give, okay, give. Sometimes 3 to 5% of dogs can get lactose intolerance. If it is happening, you can dilute milk and then be fed. If you are so particular that you want to give milk. And with milk, you can add some sugar and be fed to dogs. But for adult cat, no milk at all. It will produce diarrhea. Can cold water be given? Yes, can be given, especially in hot seasons. Can ice cream be given to dogs and cats? Ice cream, it is sweet in taste, full of fat. It is not needed for the cat. For the dog, of course, they like it, but not chocolate containing ice cream. Chocolate is toxic for the dog. Can bakery foods or junk foods be given to the? Yes, chilies, masalas, everything can be given to the dog. Nothing will happen. Don't worry. You can advise your pet owners. What food at gastroenteritis recovery phase? Of course, a easily digestible starch-containing food plus some boiled chicken. Of course, I am coming that. Bland diet. A bland diet should be given from a gastroenteritis recovery, vomiting and diarrhea, recovering phase. A bland diet is a temporary feeding plan that consists of foods that are easily digestible with low in fat and low fiber. It will help the dog or the cat digestive system recover from vomiting and diarrhea. It should contain, the dog, it should contain around 50% of protein like boiled chicken and 50% carbohydrate like boiled rice. 50% chicken plus 50% rice. That's all. No masala, no fish, no this salt, nothing. Only in that condition. Because it is recovering. The most common foods on dog bland diet. You can use in the dog's bland diet, you can use boiled skinless chicken or turkey. Turkey is excellent. White meat like breast. Poached white fish fillet, scrambled eggs, low fat cottage cheese. Cottage cheese is excellent in protein. White or brown rice, absolutely soft and fluffy. Pasta or boiled potatoes. Potatoes they are rich in carbohydrates and they act excellent as prebiotics. I already mentioned it. Avoid cooking with any oils or fat, salt, and flavorings. Make sure food has cooled down. Only give cool foods during recovery phase. You can also feed them the boiled chicken water. See, after boiling the chicken, that water is there. That also can be fed. Let them drink it. Encourage them to drink. Coming to the cat bland food. The most common bland food for the cat while recovering from gastroenteritis is poached white feet without the skins or bones from fresh or frozen. Then boiled skinless chicken or turkey. No carbohydrate. Only fish, either turkey or chicken, whatever it be. And there are certain foods or beverages to be avoided to the dog. Always keep this in mind. Number one is avocado fruit. Avocado, long term eating of avocado fruits in dogs, they can call the myocardial cause, can cause myocardial necrosis and mastitis. Goats are highly sensitive for avocado, may produce severe mastitis. So avocado should not be fed to dogs for a long term. We should advise. Our client may ask us which are the food which should not be good for the dog. Number two is chocolate. So number one should be the chocolate. Chocolate, coffee, and caffeine. All these are toxic. Especially dogs are 10 times more toxic or sensitive than humans for chocolate. What is chocolate? It is nothing but dried and powdered cocoa bean, cocoa seed. It contains theobromine, alkaloid theobromine. It is toxic to the dog. That is why this cocoa plant got the botanical name Theobroma coca. Then alcohol. Of course, nobody will give alcohol to the dog, but actually, if you drink, it is vomiting, diarrhea, CNS depression, dyspnea, tremors, coma, death. Citrus fruits, especially this Mozambique, lemons, oranges, etc., in large quantities can produce hyperacidity, CNS depression. You see, drowsiness, it produces drowsiness. Coconut oil in excess quantities can see it's an oil produces laxative effect, is diarrhea, and coconut water is rich in phosphorus. So, heavy loading of coconut water can lead to hyperphosphatemia. Grapes and raisins. It is said in some textbooks that even 4 big ripened grapes will be enough to destroy both the kidneys of a 10 kg weighing dog. That much toxic ripe grapes are. Then raisins. Raisins we know. Large amount of raisins definitely will produce renal failure. Almonds may produce pancreatitis, especially fat-rich foods also. Biryani, fat-rich foods can produce pancreatitis. Onions and garlic, we very well know that produce King's body anemia. Onions means small onions, large onions, everything. Salt and salty snacks. Excess can produce sodium toxicity. Apple seeds contains hydrocyanuric acid can produce sometimes hydrocyanuric acid poison. Dates can produce diarrhea sometimes. Avocado fruit. The chocolate. I have to tell something about chocolate because we are coming to the last few slides. Coming to the chocolate, we have the white chocolate or the milk chocolate, then dark chocolate, brown chocolate. See, the white chocolate is having the least amount of cocoa powder. Cocoa powder is very expensive, and brown chocolate and the dark chocolate, especially dark chocolate, contains the maximum amount of chocolate powder. Chocolate is very toxic to the dog, and if they happen to eat this white chocolate, mostly nothing will happen because contains only negligible chocolate, cocoa powder. But if they happen to eat all this dark chocolate, it's very dangerous. But see, I was talking inside, I'm inside my clinic only. I was talking to some of my clients, and I was explaining all these things to our clients. And one of my clients told, "Hey doctor, I'm giving lot of chocolates daily, even 5 6 pieces of Milky Bar and chocolates daily to my dog, big pieces. Nothing is happening to my dog. So far for the last year, long years, nothing is happening. When my children used to come from any place, they also buy these chocolates of them." I smiled at him. I said, "See, chocolate is a very dangerous thing. It contains cocoa powder. It is toxic to the dog. But why your pet didn't develop this toxicity? Because everything are duplicate. It is made somewhere. Everything is duplicate. And you have purchased only these duplicate things which are available from the local shops. Duplicate only because cocoa is really very expensive. All duplicate items are available everywhere. It doesn't contain any cocoa at all. It contains only sugar. That is why your pet escaped. You give the same thing which is present brought from Dubai or from foreign place US or UK. They will bring original chocolates. If they happen to eat one full chocolate, definitely this toxicity occurs. That is a very interesting story. And these are all citrus fruits. And regarding ripe grapes and raisins, almonds producing pancreatitis, onions, large onions, small onion, everything. Apple is good. Apple flesh is pulp is good, but apple seeds can produce hydrocyanuric acid poison. Dates can even produce diarrhea or intolerance. And my dear friends, with this, I am concluding this webinar. I think this webinar will be very useful to you and might have given a lot of information which some of us may not be knowing. So, my dear friends, thank you very much for listening to me, for attending the whole webinar. Thank you very much. And Bharat Mata Ki Jai. Long live our motherland. Thank you.